Hi, good day. My name is Yashia Tobia. I'm going to be presenting on part two of the Older Adult Health Promotion Project. The objective for this presentation is going to be as mentioned below. We're going to be covering four central topics. Firstly, we're going to provide a summarization of the patient's information, some pertinent information of their health history. Secondly, we're going to discuss the development of the nursing plan of care, the choice of the diagnosis, its importance, and discuss any short-term, long-term outcomes. Thirdly, we're going to touch on the teaching plan. Those are the interventions for the nursing plan. We're also going to discuss our approach and the support network that the patient has. Additionally, we're going to talk on the evaluation that's going to examine each short-term and long-term outcome, whether it was achieved, and identify any primary, secondary, tertiary preventions, and we're going to talk about the effectiveness of those plans and any revisions needed. All right, so I'm going to briefly provide an introduction of our patient and summarize some pertinent information from her. She's a 76-year-old African-American woman who previously retired as a throughway toll collector. She currently holds a home health aide position that is of PRN status. Her BMI registered at 28. She's well nourished. She has no food or medication allergy. She has a family medical history of hypertension, currently medical conditions of hypertension. She has a past surgical history of a heart stent being placed. She is on several medications that address her cholesterol, her bone health, and her hypertension, namely in form of metoprolol, hydrochlorothiazide. Next, when discussing our plan and how we're related to Healthy People 2030, we need to focus on health promotion and teaching needs. Namely, those education needs were on health practices related to nutrition, exercise, medication compliance, and screening. The topic selection for this particular patient was exercise and nutrition. And the reason why this correlated to the Healthy People 2030 and their initiatives is that one of their main initiatives was to improve cardiovascular health in adults. Upon collecting the data from the patient in relation to her demographic, her lifestyle choices, and her previous medical history, we decided upon a diagnosis of the patient is at risk for ineffective health maintenance. This was related to her history of hypertension, as evidenced by her lack of compliance to her cardiac medication. The reason why this was important to our patient is that, of all things, with our health style choices, that we were able to pinpoint that a big hole was her compliance to her cardiac medication. We wanted to ensure that she understood that the reason why she may feel a fatigue and then may feel a burst of energy other times is due to the lack of compliance with the routine taking of her medication, and that she desires to have the results, that she should continue to take her cardiac medication in order to get that result of the less fatigue. Our short-term outcomes were focused on a monthly basis. It focused on the patient demonstrating compliance of her medication. So what that aimed to do is that the patient would organize her pills for the week. She would write a log of every day after completing every day from Sunday to Saturday. And so this will just maintain and provide a point of consistency for the patient so that she can organize at the beginning of the week, a chart after each day, and that the patient will be able to show that routine compliance. When discussing the long-term outcomes, we focused on the patient taking that log, that daily compliance log, and presenting that to the physician during her 6 months evaluation. The reason why this is important is that we were able to show that the patient has been consistent with taking her medication. And additionally, if there were any signs or symptoms that have been exacerbated or have occurred during this time frame, we can see that if it was in relation to her compliance or not. So when discussing a teaching plan, what we want to do is establish a parameter, establish the preferences which the patient likes to learn. We wanted to also see if there are any variables that may impact the client's learning. So those variables related to economic, cognitive, hearing, education, family system. We want to understand the patient and whether those things could affect her. We have listed our results below within this slide. Additionally, we provided a preferred learning survey, and what the results showed was that she leveled a 3 for visual, a 3 for auditory, and then a 6 for kinesthetic. Because of the high level of kinesthetic, what we did is that we provided a PDF that the patient would be able to follow. This PDF was an outline of how she can organize her medications, and she would be able to follow this outline every week and use this as a reference, and so she'd be able to follow that. That covered the kinesthetic portion. For the visual and auditory portion, what we did is that we provided her education behind her medications, her atorvastatin, her metoprolol, her hydrochlorothiazide. And what we did is that we were able to provide her printouts that she knows what some signs and symptoms are, knows what things to report. Additionally, what we did is we provided 2 videos as well that actually spoke about the benefits of having those medications and the benefits of in the condition that she has that is causing the hypertension. Okay, so what we want to do is that just highlight a couple main things that we thought were important from our surveys of variables that can impact the client's learning. Mainly what we want to do the main one was related to family system and support. What we saw was that the patient is a retired great-grandmother, and she has the support of her husband, children, and family. So she does have 3 living siblings of around the same age, and so because she does have a family history of hypertension, we wanted to emphasize that she should lean on her family, such as those siblings, in order to establish routine patterns, maybe organize groups, outings for her to go for healthy walks, just people that can help hold her accountable with the log, especially her husband, who will be there. He can go through the log with her on a daily basis, or on the weekly, at the end of the week basis, to maintain and make sure that she's doing everything, and just provide her that support, keep her encouraged to make sure that she's doing all those things discussed in the nursing plan. In relation to the evaluation stage of our nursing process, we are able to evaluate the short-term and long-term goals, outcomes, and whether they were successful. We were very successful in our short-term goals. The patient was able to demonstrate compliance. Additionally, the patient reported that she felt well informed about how to organize her medication due to the guide that was presented to her. She was able to identify a successful way to organize it on a weekly basis from Sunday to Saturday, as well as hold herself accountable by signing off or logging a log of daily completion, in which she would present that with to her husband at the end of the week. She also informed that her husband, her siblings, and her grandchildren were a great support system for her. She did a report back that she felt well informed due to her due to the YouTube video links, as well as the documentation in relation to her medications. The only limitation with that is that she would have is that we didn't have more physical resources for her, since she's a kinesthetic learner. Our goal for the next time would be able to provide her more guides that would be able to help her with either preparing to increase her healthy lifestyle. So in relation to foods, exercise routine, those would be the guidelines. Those would be the guides that she most enjoyed, and that correlates to her learning as a kinesthetic learner. In relation to the primary, secondary, and tertiary preventions, we showed that for the primary, the healthy lifestyle, including control of diet, exercise, medication compliance, body mass index of 28, which she currently held, left her under the level of obese, so that was great. As well as we had a target of 140 over 90, less than 140 over 90 for the blood pressure. In relation to the serum, in relation to the secondary prevention, we had a routine screening of serum blood work related to serolipid counts, cardiac stress levels, C-reactive protein levels. And for the tertiary, the goal was to slow the progression of any heart-related diseases, congested heart failure, and just reduce the risk of repeat events. The patient already had a stent, so we want to prevent her from having any type of heart-related issues, heart attacks, and things of that nature. We want to thank you for being a part and allowing us to present this information of our patient. We thank you and look forward to your feedback.